In this video, we will explore the concept of treating hernia but without surgery, a topic that frequently crops up on YouTube and internet platforms. First, we want to find out what is a hernia, what are its biggest danger, and can it even effectively be treated without surgery? Can you reduce the risk if you do have a hernia? And can you improve hernia symptoms once you do have a hernia? To try and understand what is a hernia, let's look at this picture. So this is the abdominal wall, and this is the outside, and the abdominal wall keeps the contents on the inside and does not allow anything to come out. However, so now there is a defect in the abdominal wall as seen over here, and this now allows the lining of the abdominal wall to pop out towards the outside, but also you can see a loop of bowel protruding out. This defect that allows the inside contents to overcome its coverings and move to another site is called a hernia, and the commonest place is the abdomen. The common hernias are shown around the belly button, in the groin, and if you've had an operation, the incision sites. The biggest danger of a hernia is its potential to trap whatever comes out or pokes out of the defect. And looking at this picture, you can see that this is the abdominal wall, this is the hernia, and a loop of bowel has come out and has gotten trapped in this part of the hernia over here, which is called the neck of the hernia, where tissue can get strangulated. It loses its blood supply and the tissue, in this case the bowel, can die. This is a life-threatening complication, and patients suspected of strangulation ought to go to the hospital immediately for emergency surgery. The important question is, can you treat a hernia without surgery effectively? Well, let's look at this picture again. And here is the defect. It is a physical defect. It will not go away. You cannot take medicine for it. It is an actual space that is created because of disruption of a layer that used to be there. Hence, no amount of yoga, muscle development, exercise, diet, traditional medicine, homeopathy, or external contraption can treat this hernia. And it is a dangerous assumption that you can do any of this to treat the hernial defect permanently. So the answer is no. Unfortunately, there is no effective treatment without surgery. However, can you reduce the risk if you do have a hernia? What if you are not fit to have an operation? What if you do not want surgery? What if surgery is not accessible? You are in a part of the world where you are unable to arrange an operation for yourself. What if you cannot afford to have a hernia repaired? In these instances, or if you are waiting to have a hernia operation and there is a waiting time, it is important to remember that the hernial defect is the weakest point in the abdomen. And anything that increases the pressure in the abdomen will push the contents out at the weakest point. A bit like in a bicycle tube where there is an area of weakness before it punctures, it causes a bulge to appear. And the more pressure you build up in the tube, the bulge gets bigger before bursting. In the same way, anything that increases the pressure in the abdomen, such as lifting heavy objects, straining to pass motion when you're constipated, exercises that increase the pressure on the abdominal wall, in men straining to pass urine, all of these activities will increase the risk of the abdominal contents passing outside and increase the risk of strangulation and getting them trapped. So to reduce that risk is to understand these risks and to avoid, where possible, such activities. So is there anything else that we can do to improve the symptoms of the hernia other than not straining while we go about our day-to-day life? Let's look into that. So here's a cartoon of a hernia which is popped out outside of the abdominal wall. What if we could push the hernia back in so that the hernia now sat inside, and then we could find some way of applying pressure and keeping pressure at the site of the defect, preventing the hernia to come out again. So in effect, we have reduced the hernia, we have pushed it back, and now we are going to keep it in over there by applying external pressure. Concept has spawned a mini industry of devices and contraptions called a truss. Let's look at some examples and the ins and outs of wearing a truss. It is important to understand that for this concept to work, the hernia must be the type that is reducible, that goes back inside. Otherwise, by putting a contraption on top of a hernia that is not reduced and has abdominal contents such as bowel hanging out, you are in effect squashing the bowel against the abdominal wall and not doing anything at all to the hernia. And this is a key concept. So the hernia ought to be reducible, go back inside, and the fit of the device has to be good so that it stays there and keeps the hernia reduced. And it has to be comfortable to be able to sustain its use. And finally, of course, it has to be cost effective. Now let's look at some examples. In this example, we can see a groin belt which is pushing up against this region where commonly an inguinal hernia arises, and see how it has been set up by providing a soft cushion with pressure and then all of these straps keeping it in place. A similar example, but over here the support is not obviously evident. Midline or incisional hernia may also be supported by belts which are either broad, or they may support a little firm ball that pushes up against the hernial defect. So the obvious question is a truss effective? Is wearing an external contraption going to help you? There is limited evidence that when used appropriately for certain types of hernia, such as an inguinal hernia, less commonly an incisional or midline hernia, that these devices may reduce the symptoms from the hernia in our day-to-day life. What are the downsides of wearing external devices? These can be expensive. They are not easy to keep in place once you put on, and it is important to understand that the hernia has to be reduced before the device goes into place. These are inconvenient. They may not always be effective if the hernia cannot be reduced or gets bigger, and they are dangerous if they are put on when the hernia has not been reduced. They cause chafing and skin irritation over a period of time. They may lose their effectiveness if the hernia gets bigger, and sometimes they may increase adhesions within the hernia, especially in the groin, making subsequent surgery somewhat more complicated. This was a brief overview of treating hernia or controlling its symptoms without surgery. I hope this was of use. If you have any comments, please do share.